Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Undisputable.
Undisputable, maybe.
Maybe.
It's getting there.
Right. All right, Brad, what do you want to talk about today?
Well, Bob, we're going to talk about tennis elbow.
Lateral epicondylitis.
Yeah. Tennis elbow is a little easier to say, makes a little more
Right.
sense. People playing tennis, the backstroke is where it comes from, not the front stroke. I'm not a tennis player or whatever that's called, but it's on this side of the forearm. This would be the palm side, we're on the back side, and it happens right where these muscles connect to this bone. That's the lateral epicondyle. And
It can really happen with any gripping type, repeated gripping type activity.
Yep.
Like if you're trimming the hedge.
Yeah, it's amazing that people come in, to the clinic. One guy, he was doing the weed whacker.
Sure.
Yep, people
would do it.
using a cordless drill or something, doing
Sure.
a lot of that weekend warrior or repetitive motion or a
Yeah.
combination. But what happens is you'll find a real tender spot.
Oh, it's tender.
Oh, and if it's really flared up, I've walked through a doorway and just touched
Bumped
it. And it makes you say bad words, at least me. Anyways, that's what we have. And we're going to show you a really nice technique and a couple tricks along with it to get this to settle down in a quick manner.
Good.
So the treatment is 3 minutes long, the primary treatment, but we're going to show you a couple little tips. For example, big thing, this is kind of a common sense thing. Avoid the pain makers or anything that sets it off.
Right.
A lot of
You
times.
got to get to calm down.
Yep. I know with me personally, when I had it on both arms, if I
Yeah.
had a doorknob that was kind of hard to twist, would that flare it up. So use the other hand, in a case like that.
When I was in school for PT, I actually got a case of it, and I would carry trays
Yeah.
as a waiter,
Yeah.
and that hurt.
Oh.
Yeah,
So
I
what'd you do? Make the customers carry you?
That's right. That worked out really good.
Yeah.
I'd give them a tip.
Yeah, that's a good example of something you may not think would get it
Yeah.
going, but it can. So if you happen to have a job or something where you have to do things that irritate it, I would highly recommend getting a strap.
Right.
Okay. There's a tennis elbow strap is what they typically call them. They make a lot of different
There's a lot of
styles.
variations.
I've always liked this one that has an air bladder in it.
It's called Aircast.
Yep, Aircast.
By Aircast.
Yep.
I too had the best luck with these, if
And-
they're going to work.
Yeah. So
They're magic, but they help.
So what I would always recommend for myself as well as patients is you're going to put it not over the point
Right.
painful spot, but just
Just
distal.
a little bit towards the hand.
Right. And then when you're going to start using something, then you're going to tighten it up and it's going to disperse the
Right.
pressure.
Puts more of the pressure here than on the bone.
Exactly. Into that muscle belly. Now don't leave it tight all day
Right.
long. Only use it tight when you're doing
Doing the
that
activity,
activity.
yeah.
Hopefully it's not for a long period of time. And then simply loosen up with the Velcro.
Right.
Leave it on. So I highly recommend that if you cannot avoid the pain makers. If you want, and it's really sore, you can put a cold pack on
Right.
there for.
Always helps.
Yep, that's always a good option. Now, the main treatment of the day we're going to talk about is, I don't even know if I need to sit here. Get yourself
You need a butter knife.
a butter knife, okay? And, it's got some round ends. We're going to use the handle of the butter
Right.
knife,
Not the blade.
not the blade. So forget about that. You're not going to use a regular knife.
Right.
Something that you can go like this and you do not cut yourself.
Right.
Okay, get yourself any kind of cream
Right.
that is, moisturizing cream. Doesn't matter what it is. And we're going to use that for a lubricant. Okay, now we're going to take the knife and here's that painful spot.
Again, handle.
Yep. And we're going to go not on the bone. It's going to hurt if you go on that painful spot.
There's the bone right
Yep.
there.
So I'm going to go just distal or a little bit away on the muscle belly.
A little bit towards the hand.
Yep. And I'm going to do this motion. This is, if you're like from the north and you got snow, this is like a shovel. If you go this way, we call raking. So we're going to shovel. We're not going to
Not
rake.
raking.
Yep. And you go like this, and you push down, not really hard, but you're putting some pressure on it.
Right.
Now it really helps out if you use a pillow or two.
Sure. Keep
Big,
it supported.
yep, allows you to relax.
And
Big
again, you put the
difference.
lotion out first.
Oh, there we go. And we're not going to be stingy with it, you know. Get it on there. Where's my?
Okay.
Rub it around. There we go.
And it's
And-
like you're frosting the cake.
Yeah, there you go. And so it's here. I'm going to not just go here, but I'm going to go over all those muscles. We call it the muscle belly.
You're getting red already.
Yep. So what Bob's referring to as the red is your skin will actually get red,
Yes.
which is a good sign because that's being red from blood flow. And we're talking about more
Right.
blood flow, which is a good thing. And we're relaxing those muscles. We're increasing the blood flow. And this is,
And it's quite often going to leave a mark.
yeah. Now,
I mean-
usually a couple, 3 minutes. I put 3 minutes on the title. That's probably the max, depending on how hard you push.
Sure.
Now, what can happen is, can you see that, Tanner? Can you see that it's getting a little red in the?
Yeah.
Okay. So once you start seeing that red, this feels good. It'll typically feel like a good massage. Then you're done. Where's my towel? All right. Make sure you have a towel handy so you don't have to make a mess on the furniture and whatnot. If this redness should go away within an hour or so.
Sure.
Now it can actually stay red and look like it
For
can,
days on
yeah,
end.
it can look like a bruise, and
Right.
it is. It's blood flow. That means you overdid it.
We are warning you.
Yes,
It's very easy to do this.
exactly. And some people like myself, if a little's good, a lot's better.
Right.
That's not true. So take it easy the first
Heineck
time.
method. Brad Heineck method.
We call it the Heineck maneuver.
Yeah, that's right.
Yeah. So
Overdo it.
anyways, getting on with that, we're
So would you do it every day?
yes, every
Mm.
day. After, like I say, the redness goes away. The next day, you can do it again, and as it improves, then you're going to decrease how much you do it.
Sure.
So as it gets
Like
better,
every
you do
other
it.
day. or-
Yes.
Right.
Exactly. If it is bruised the next day, usually it's 2 to 3 days for that bruise look to go away. Then you can go
Sure.
at it again, assuming you had good results with
Right.
it.
Right.
So there you go, Bob. That's
Another option, Brad, is the massage gun, right?
right. If you happen to have one, I don't know if I'd go out and buy one just for this, but if you happen to have one or a friend has one,
Or if you want to use it for other things, I
Yep.
mean, because it can be used anywhere on the body,
Right.
obviously. But Brad's method is actually quite ingenious. He actually puts the ball on there. It has 5 attachments,
yep. Here's the other
Yep.
4.
and they just pop on, pop off, and you hold it for 3 seconds to start.
Yep.
And now you don't go directly on the bone again,
Yep.
and you don't go direct like you're drilling for oil here.
Right.
You actually
Like
want to
a-
go in from the side.
There you go.
And the same thing again.
Yeah, get a pillow under there.
Yeah. Same thing again. So you're going to saw back and forth like you're. I got a piece of wood here.
So this would be it. We talked about cross friction massages, which
Right.
have been done therapeutically for decades, and it works well. And it's not too hard on the hand. And
Right.
usually you won't get that redness or that bruising from
Right.
this.
Plus, you want to get the entire muscles
Yep.
because these all, if they're tight, they're going to put more stress on the lateral
Yeah.
epicondyle.
The more relaxed this whole muscle group is.
I might hit my other side too bad.
Yeah. You can use it on your legs. And actually, I do want to mention this technique. You can use it on other parts of the body. We did do a
Sure.
video specifically on how to do it on the quadriceps where it connects to the kneecap. So you can look at that video as well.
Yeah.
But the concepts are all the same.
Right. Very good.
Very good. So good luck with that tennis elbow. We know how difficult and
Stubborn they can be.
yeah, it'll last for months sometimes, Bob.
They're like a man in your life.
I'm glad
Yeah.
you brought it up about man because we've been having comments about the
Don't even say it. Don't. Men are the problem.
yeah, it's all our fault.
All right.
Take care.
Thanks for watching.